directions of tympanic membrane is not only straight device, but it makes a 45-degree with horizontal line. Again, this direction is not only like this, but it's directed downwards and laterally in such a way that the anterior wall as well as the floor is comparatively larger than roof and posterior. So this is the one of the important clinical importance. There is the 55-degree obliquely situated. That's why its anterior and floor part of this canal is larger than the roof and posterior walls. Now we will discuss in briefly the blood supplies, nerve supplies and lymphatic drainage. External ear. Here we can feel the one artery, superficial temporal branch of external carotid artery. It supplies the mostly outer part. Behind the auricle there is posterior auricular artery, branch of the external carotid artery. Then internal acoustic meatus is supplied by branches of maxillary artery. There are so many branches of maxillary arteries, few branches supplies this. And tympanic membrane outside is also supplied same branches of the which supplies the inner surface or inner part of the external acoustic meatus and inner surface of tympanic membrane supplied by branches of the deep auricular artery of the branch of maxillary of middle ear. Nerve supply. Nerve supply of pinna is again divided into upper and lower part. Lower part is supplied by the greater auricular nerves. Another branch, outer surface, is supplied by one of the branch of mandibular. It is auricular temporal nerve. Posterior surface is supplied by lesser occipital nerve, and one of the small branch around the concha is supplied by auricular branch of pedicus. So many nerves which supplies the pinna. Now external acoustic meatus is supplied by the same two nerves. Auricular branch of vagus supplies mostly the posterior half and auricular temporal nerve. Tympanic membrane outer surface is supplied by the same nerves which are supplied by the external acoustic meatus, but inner surface of tympanic membrane is supplied by tympanic plexus. Tympanic plexus is formed by one of the branch of glossopharyngeal nerve. So this is the nerve supply and blood supply of the external acoustic meatus as well as tympanic membrane. Lymphatic drainage is mostly supplied towards the pre-auricular, retropharyngeal, mastoid part of the lymphatic drainage, and venous drainage follows almost the arterial patterns. Now we will discuss about some applied aspect of the external ear and external acoustic meatus. In day-to-day life, as we have told, this part is we are using like when we wear the spectacles, then external, suppose there is no pinna, then what happens? Some small workers like tailors or some carpenters, they are using this ball pen or the pencil, and they are routinely use the like this. This is also one of the use of this pinna. Doctors are hearing the auscultations, at that time it puts the plug on this external acoustic meatus. Earrings, we are particularly the girls are using. This part is piercing the mainly non-cartilaginous part. It is fiber. So these are the some use. Apart from this, clinically, if you will go in the clinic in early exposure of clinical trials in ENT department, then just watch or examine how the ENT surgeons is hold the external pinna. They push backwards, laterally and upwards. This is the purpose to spread the external acoustic meatus. And in this way, the light is through and maximum area of tympanic membrane can be seen. But same thing in case of the children, is draws directed downward, backward. This is the things you have to note. This is the anatomical importance of this method. When light is through, the illuminations, that means antero-inferiorly, this area is triangular area is clearly seen, and above the part is follows the handle of malleus, because the tympanic membrane is semi-transparent. That's why handle of malleus is can be seen. And part behind the antero-inferior, this is postero-inferior part. It is deepest part where the collections of pus is there, and that's why drainage of this pus, generally tympanic membrane is makes the incisions here in this postero-inferior part is known as myringotomy, drainage of pus from the middle ear cavity. So this is the clinical aspect of light, how to hold the external and these things. Another one things, most common disease is collections of wax in external acoustic meatus. Sometimes it becomes very hard. At that time, what happens? They are giving us some saline syringe forcefully in the external acoustic meatus, and in this way, it's try to remove the wax. And at that time, one danger thing, sometimes the auricular branch of vagus, if it is stimulated, then there is sudden cardiac arrest may be take place. So this is the syringing of external acoustic meatus. Sometimes there may be bleeding between the cartilage as well as the skin of pinna, and at that time there is hematoma formations is take place, and there is the irregular shape of ear is formed, is known as cauliflower ear, particularly seen in the wrestlers. So these are the some clinical aspect of the external ear as well as the tympanic membrane. So here we will finish the gross anatomy of external ear. Next part will be taken in the next lecture as middle ear and